study, a prospective study.
cross-sectional study. So the duration of the study would be
Duration of the study would be 3 months.
3 months. So will you be doing any follow-up of anyone?
There is no follow-up in this study, sir. There we are
No follow-up.
comparing obese and non-obese and what is the change in them.
So you want to find out basically difference between obese and non-obese, right? Now,
No, sir.
if
The
you
difference is between the BP response in obese, VO2 max in obese, and in comparison with the non-obese.
yeah, but the changes you would like to see, or the variable would be, one of the variable will be blood pressure, no?
Sir, just a
Blood
minute.
pressure. Blood pressure will be one of the variable, then you will be measurement will be you will be measuring weight,
Yes,
height,
sir.
and then your skin fold thickness. Are you going to take?
No, sir. Weight, BMI, height and weight, and calculate BMI, waist circumference and hip circumference.
Okay, all those things, yeah. So and there will be you will have a BMI versus blood pressure, and you will say muscle strength or something like that.
BMI versus
What? You will, in addition to BMI, what else you are going to measure?
Waist circumference.
Yeah, waist circumference, hip circumference, height, weight, you will calculate body mass index, etc. Right?
Yes, sir.
So these are your input variables as such. These are the variables which will affect outcome variables. The outcome variable are, do you say that it is blood pressure, or you are not going to measure blood pressure?
Blood pressure response, yes, sir.
Blood pressure response. Anything else?
And VO2 max, oxygen consumption.
Oxygen consumption. Okay. So what is your hypothesis?
Sir, obesity causes exaggerated BP response. What we are trying to observe is during exercise, there is an increase in the blood pressure in normal person.
Yes.
But this increase will be very high in obese. This is our hypothesis.
Okay. So we are essentially comparing two things. One is the normal people, other is obese people.
Yes, sir.
And you are going to take measurement only once.
Only once.
Only once. And that will then be a hypothesis will be to measure the acceleration or how much more response, what is the difference pre-exercise and post-exercise responses in obese and non-obese people, right? This is what you want to compare.
Yes, sir.
So at least there will be, when you say the cross-sectional study, it's okay. But essentially the statistical test which you are going to apply, right? So you want to use which statistical test?
Sir, for comparing between pre and post effects, paired t-test will be used, sir.
Okay, paired t-test you want to use it. So now tell me but between two paired tests you need to compare. So obese people, whether there is significant rise or not, non-obese, whether there is significant rise or not. So essentially you will be measuring if you want to apply t-test, now to compare between two differences, then you need to pair one obese versus one non-obese. Within individual you are comparing, that is okay.
Yes, sir.
But otherwise also you need to pair one obese, one non-obese, and then you can do the pair t-test. Other thing is unpaired t-test. You may have around 30 obese and 80 is a non-obese, and then differences you will compare. That could be another way
Yes, sir.
you compare. Then what will be your population size?
50, sir. 50 in each
Population,
group.
population, total population from which you are going to take a sample.
Uh, that will be like those who are visiting the gymnasium.
Yes.
So that will be around
So,
200 to 250, sir.
so how many the gym you have selected?
Only one, sir.
Only one.
Ah,
So the study will you say that the population who visits a particular gym. So whenever you
ah,
publish a research paper, it will
mm,
be applicable to only one gym.
mm,
And
okay.
in future, ideally, at
Mm.
least if there are, this is which city you are staying in, which city?
A rural area close to Chennai, sir.
Chennai rural area. Okay. And there is only one gym around.
Yeah, one gym around.
And those who are not going to gym, that you are not going to compare.
No, sir. I'm comparing only obesity.
Yeah, obesity, but only those who are going to gym.
Ah,
So those who are not going to gym and still obese will not see
he
their
will not be
response.
considered. No, sir.
So,
Those who are coming to the gym, among them who is obese and who is non-obese.
so when we complete our study and write a letter, the research paper, our limitation would be we have
Ah,
taken only one gym. That's the purposely sampling technique,
hmm.
and
Okay.
then the study will be the applicable to only this. Whether the obesity, non-obesity, whatever you have done, it is only applicable to this population who are coming to the gym.
Yes, sir.
So, and do you expect that there will be any expense in this project?
Expense, sir.
Any expenditure will be there?
I don't think so, sir. Nothing,
So,
because they are going to pay for the gym.
yeah.
They are just taking their consent.
Yeah.
Those who are attending.
So, so ideally, what you should be doing, let it consider as a pilot study, which you are doing it, right?
Hmm. Hmm.
And then, if possible, if not now, in
Hmm.
the next 1 or 2 months, once your study is over, maybe after 3 months, you should write a research proposal in which you at least write the budget of not less than 50 lakh rupees, in which not only gym, surrounding gyms, but also direct population you should also take. And based on
Hmm.
this study, if you find that there is a difference in the blood pressure response, then we
Hmm.
should have an intervention package also should be there, how to reduce obesity, right?
Okay. Okay.
So
Oh,
post a free intervention, a post intervention, obese, non-obese, if you just try to have the 50 lakh rupees budget, that will be
hmm.
much more, and you can have a multi-centric. I'm
Okay. Hello. Hello. Sir, I'm unable to hear you.
I just muted for an urgent thing. So basically, if you write a multi-centric study, so many other people will also join. And this study should be followed up ideally by, because you have taken measurement, you have taken consider, done everything, but then
Hmm.
you have a knowledge also for the
Hmm.
how to reduce the obesity. And if we do not impart our knowledge to the people, then it's a bit looks a bit not morally wrong, but not morally right also.
Okay.
So, whenever we do some kind of research, it is better if we do some kind of intervention. Even if you can't do
Hmm.
intervention, at least you can have a one PDF booklet on the obesity, so that you can share with the participant. See, if we
Hmm.
If we take a single minute of our research object, then it is our duty, moral duty, so that he gets benefit from our side. So
Hmm.
now when we talk about sampling, are you going to take 100% sample, or you have on a particular time also person coming you are going to take?
Particular time, sir.
There are 10,000 or 1,050 people are coming. So
Hmm.
all the 50 will be taken by you, or again a purposely you have a purpose sampling that during 9 to 5 like that.
Only between 9 to 5 hours, like that.
Only between 9 to 5. So again, purposive, within that a purposive sampling. So your
Hmm.
population the sample will not be representative or even of that gym population. Anyway, you can go ahead.
Hmm.
Now, the something which can be done. So how me, what would be the sample size? Can you tell me that?
That's what, sir. 50 in each group.
15, 15,
50.
50 in
Hmm.
each. So, and have you used any formula to calculate
Sir,
sample size?
yes, sir. According to the formula, yeah, it was around 165.
Hmm.
We will collect 165. We rounded it off to 170.
Hmm.
Out of 170 people, how many are obese? We are going to see. How many are non-obese
Yes.
attending the gym?
Yeah. So, by chance, if you don't find enough number of obese,
Hmm.
then you will have some other test also to apply. What we have learned about the uh, non-parametric test that can be used if sample size is too less. But you may continue your study. But now, when we say obese and non-obese, it will be much better if you compare the correlation coefficient, because
Yes, sir.
when you write obese non-obese, you are converting the continuous variable into a category variable by taking some kind of the borderline. So at a now international level, if you want to present, it is much better to compare the correlation coefficient, the BMI versus difference in BP response. So that will have a better answer compared to the category, the variable, right? So both way you can do.
Okay.
You can
Okay.
divide some kind of the category based on a borderline, and
Hmm.
whenever you prepare a cutoff line, if you draw a normal distribution curve, and then if you have a sharp curvature somewhere, and at the sharp curvature, if you take a borderline, that will give you much better answer than the borderline, whatever we want to use, like international standard and national standard, etc. Instead of that, if we do this kind of analysis, it will give you better result. So I think you go ahead with this, and let's see
Hmm.
the result, right? And
Yes, sir.
but do follow it up with, if possible, even in the small sample size, you try to reduce the obesity and see the result. That will be much better if you can do the randomized control trial. Out of this
Okay.
50 obese and 100 non-obese,
Hmm.
what you can say that randomly divide into two groups. One group you advise, other group you don't advise. And then after 6 months, even you can do the crossover design.
Hmm.
And then probably you will have much better result. Uh, so now, if you have any question now,
No,
so
sir. Hmm.
we should go to the another discussion. Who will be presenting their find the title of the study,
Hmm.
then the
Sir,
population. Yeah, please.
sir, I'm Dr. Meenakshi.
Yes.
My topic is the vibration perfusion threshold is the most reliable test for the early diagnosis of diabetic neuropathy in type 2 diabetic mellitus patients. So
Yes.
I have taken the 60 patients who is having a symptoms of diabetic neuropathy like tingling, numbness, pain, and all that. And
Mm.
60 patients, they are diabetics, but they are having no symptoms of the diabetic
Yes.
neuropathy. And 60 patients, they are comparing normal. So they are
Mm.
having no diabetic mellitus. So
Yes.
in that, when there is, the subjects who are having a diabetic neuropathy,
Mm.
the vibration perfusion testing or threshold is more than 25 or 30 millivolt. So that is the one instrument you have to measure the vibration sense. So when you, it like that of the tuning fork. So when you hit the tuning fork and put on any bony areas, there is some vibrations they feel. So like that the instrument is there, and it will be more reliable than the NCV, that is a nerve conduction study. So it is a, you have to early diagnose the chances of diabetic neuropathy in subclinical cases as well as the clinical cases. Means those who are having symptoms of diabetic neuropathy like tingling, numbness, and all that, and those who are having no symptoms of diabetic neuropathy. So in that subclinical cases, you have to early diagnosis. There may be chances of diabetic neuropathy.
So you will have ultimately three groups. One group
Yes, sir. Yes, sir.
having symptom,
Yes, sir. Without symptoms and
another
normal.
group
Without
no
symptoms and
symptom,
normal. Huh.
no
And I have
symptom and
taken the
normal.
HB1C, then fasting blood sugar, post meal blood sugar, BP, and physical parameters like BMI and all that, height, weight, age.
So you will have three groups A, B, C, no symptom and subclinical.
Yes,
Now in having symptom also,
yes, sir.
there can be two tests you will be applying, nerve
Yes.
conduction test and your perfusion
No,
test.
no,
Right?
only I have applied only VPT, not nerve conduction in that. So we have to
Nerve
know the early.
conduction, but nerve conduction, if you take it, is very costly affair.
Yes, sir. Yes. No, no, not costly, but I have that,
We
but
are a
not time. I will be done
But
it in the next month. There is a
okay,
shortage of
maybe not.
time and all that
Yeah,
because
yeah,
of
I
the
agree. But
examination.
in future, in
Yes,
all
yes,
the
yes, sir.
three
In
groups,
future, I am taking this nerve
yeah, all the
conduction.
three groups, both nerve
Yes,
conduction and your
yes.
perfusion,
VPT,
vibration perfusion test.
VPT and all that. Yes,
Uh,
sir.
then can you which kind of statistical test you are going to use in this?
Which kind of
Statistical
sta-
test you are going to use?
statistical? So here I have to use the chi-squares test because it is an observation. Means suppose there is a there is a categories of the VPT test. Means up to the 10 volt it is a normal, 10 to 15 it is a mild, and 15 to 20 it is a moderate, and more than 20 or 25 it is a severe type of vibration perfusion threshold. So in that we have to categorize the patients. So if the patient feels the vibration at a 30 millivolt uh, so the patient is having a severe category, and that may be more chances of development of the diabetic neuropathy. So you have
So
to
the
only you have to calculate the percentage from that. So how much percent peoples they are having? Suppose the 133% persons having mild, 32, yeah, 30 is having a moderate and severe. You have to categorize like that.
yeah, but here you can use kappa agreement test also.
Yes, sir.
Kappa agreement test in a sense that your nerve conduction test says that the person is having and your test says not having, and
Yes,
sometimes both say yes, both say no. Sometimes your
yes, sir.
test says yes, their test says no. So
Hmm.
this kappa agreement will be one of the tests which you can use it, right?
Yes, sir.
Second thing will be the population which you will choose. What will
Hmm.
be a population from which you are going to your sample?
So they are coming to our hospital that is in medical college. So maybe
So
around thousand of people.
all the diabetic patient you are going to choose, or you will be choosing some of them.
Some of them diabetes, those who are
So
having a
it will be
HB1C, HbA1c more than 12
agreed,
or more than
agreed,
10.
but it will be a purposive sampling or random sampling.
So it is a random sampling.
Random sampling, then each patient of diabetes coming to your hospital an equal chance of being selected. Then only you can use the word
Yes, so there is
random.
a one diabetic OPD is there in our hospital.
Agreed, but
And
even the patient comes at 8 p.m. or let's say
yes,
6 p.m. or 1 p.m. All these patients will have a chance of being included in your study or only few particular hours
no, no,
like
sir,
that.
particular hours. OPD hours.
So, so it's a purpose.
That,
It's not a random. It's a purposive sampling, right?
it is purpose. Okay,
And
sir.
and always remember that purposive sampling has much limitation value at international level. But
Okay,
for the
okay,
pilot study, it is wonderful. You can go ahead for kappa
okay,
agreement, for example. There won't be any problem. But
okay, sir.
when you want to take at a larger scale, right?
Yes, sir.
As I understand, it will be not costing too much. So
Yes,
same
sir.
way, previous person I said that you write a project proposal up to 50 lakhs, you should also write up to 50 lakh, and
Yes,
then
sir.
you should take certain people from the committee also
Yes,
and
sir.
try to take a random sample in future, not now, maybe after 2 3 months,
Yes, sir.
and you
Yes, sir.
can
Yes, sir.
employ a
Definitely.
lot of people. And your sampling technique also, when you take a larger sample, you will know how you should be taking sampling. Suppose in your OPD also, if you
Mm-hmm.
have 1,000 OPD, you have a list of that old patient, new patient. From
Yes,
old
sir.
patient, you can
Mm-hmm.
take your phone number and then
Mm-hmm.
randomly select. That will be
Yes.
much better rather than going purposely. And the selected patient, then you can say, please come between this time. So
Yes, yes.
whenever we use any statistical method, try to do as much as possible for ideally, and
Mm-hmm.
then whenever not possible, you go for feasible.
Okay.
So that will enhance the things. And here also,
Mm.
although you want to go for the chi-squares, etc., but
Yes, sir.
still, I would say that instead of the dividing into category 30 and 15 or something like that, let it be
Yes.
as it is, that reading in that form, and also
Okay.
take a glycosylated hemoglobin as it is rather than higher or lower, and then
Yes.
glycosylated hemoglobin versus this. If you take this, the correlation coefficient, that
Yes, sir.
will give you much idea. So,
Pearson coefficient.
uh, yeah, so unusual tests like kappa agreement, unusual tests like the coercion coefficient,
Mm-hmm.
this can also be used. You
Okay.
have now any question left out?
No, sir. No. It's okay, sir. No
Okay.
problem.
Yeah, so
Okay.
Dr. Sachin, can you present your things?
Thank you, sir.
Dr. Sachin, can you present your things? Yeah, please, your population, title of the study. We can't listen you. Dr. Sachin, are you presenting something? We are not able to hear you. Hello? Sachin Kumar, mic might not be working. So, uh, Naveen is there. Can you please present your case, population and sample size, etc.?
Uh,
Dr. Sachin, you need
Yes,
to improve your mic. Yeah, Naveen, please.
yes, sir. Good afternoon. Sir, I
Good
plan
afternoon.
to. I have just a loose draft. I had a plan to study the effects of statins um, on the patients of dyslipidemia before and after. So this is a sort of a study which I have a loose title that prevalence and factors associated with cognitive impairment in patients or on statins, in patients of dyslipidemia who are on statins. So this is a pre-posting.
Ah,
So bear with me, bear
I-
with me.
yeah, I am. You are too speedy for me to grasp. So, one just statin is a medicine you want to use it.
No, yeah. These are the statins are medicines which are used in patients with dyslipidemia.
Hmm.
So what I plan to do is I have a loose
Hmm.
draft that maybe the title may be the prevalence and factors associated with cognitive impairment in patients of dyslipidemia on
Hmm.
statins.
Okay.
So I have a few questions. I'm not very sure about this. I just made a loose draft.
Okay. So, just
So
think
this
of
is a yeah. So what I
which
want to do is
population
I
you are
want
going
to
to take.
we are planning to do. I will be associating with
Okay.
some PG
Sure.
students also. So this is a
Of the project
yeah,
proposal titles which we have given to shared with you, under that title, if you write, it will be much systematic, and then we'll be able to put input in the your study. You have any rapid question right now?
yeah. I have a question.
Yeah.
The questions is this will be a time series study. Like initially, I will be doing this their cognitive scale, which is a MOCA scale, Montreal Cognitive Scale. So I will be
Hmm.
using this scale before and after. Say
Yes.
after 6 weeks, say after 3 months, and then after 3 months. So
Yes.
this will
Yes.
be this will be what we call a non-parametric treatment test would be applied.
In
Okay,
this
sir?
case, if your sample size is more than 30, let's say 40, 50 like that, right? At the same population we are using, then PAT test can be used. And
Okay, yes.
in case of the epi info, when you use the word, right?
Mhm.
Say your data should be continuous. Even the same person you are measuring, suppose person ID number is
Yes, yes,
30.
sir. Yes.
I
So
will
same.
use Excel. I'm using Excel file for you to how you are going to keep your data so that everybody understand that. Just look at this
Yes.
Excel file.
Okay.
It will take some time. Um, so anytime you want to compare pre and post, your data should be like this. Say one is the serial number, then pre or post,
Baseline and then 6 months and then after this say 9 months or so.
or instead of using the pre post, this is a pre, then 3 months,
6 months.
then 6 months,
Yeah.
like this, right?
Okay.
So your
Okay.
data, say serial number one, as a pre, it may be in terms of milligram. How do you keep it?
Yeah, it is a score.
Score.
Say
So
the
score
normal
will be
score is
how between what to what?
say between 25 to 35 like this.
For timing, let's say the 25, then say let's say the 30, and let's say it will increase or decrease.
Sir, this is what I have to see whether it increases because
Okay,
there
okay.
are
Let me
instances.
let me give arbitrary figures right now.
Okay. Okay.
So, and the
So with
person's
the
other
detailed
data will
data.
also be there:
Mhm.
age,
Yes, yes.
gender,
Yes,
uh,
I plan to have
etc.
say alcohol drinking, smoking, BMI, diabetes,
Yeah, yeah.
hypertension, lipid profile.
Gender, male. So the data will look like this, but when you analyze this data, it should be kept like this. Try to understand this. What I will say, insert the same data, it should be like this. Serial number. So time series and then value, age, gender. Now it looks very simple, but when you do the analysis, this arrangement is very important. This is a pre, value is 25, age
Mhm.
34, gender male.
Mhm.
This is one. This is 3 months data. This is 30. Age will be the same. This is a, and your data is not going to come at a stretch, right? But ultimately, it should be kept like this. Then only you will be able to do it. Now, this data, which is stationary, the same data is there, right? Those
Mhm.
data can be kept in other file, but the serial number that will should be the common. So other file could look like this. This is an advanced test for relational database. Suppose you don't have this file. And so because it is going to repeat. So on one side, you have this kind of data, other side, you will have this kind of file, all those variables. And because this remains the constant, suppose, then it could be another file. But if something like blood pressure, for example, this cannot be in this file. So the parameter which you want to compare, that will be changing every time. Then BP can be kept over here. So for time being, you may not the separate two files, but in future, when you are dealing with the thousands of data, this is to be utilized.
Okay.
Okay. So when this file is with you, at that time when you use the command, when you want to compare, at that time you will be comparing this thing, time series, when you go to the AP info for the purpose of data analysis. If you keep your data like this, AP info will not be able to analyze your data. So data should be kept like this. And then you will be able to compare three groups, right? For the sake of explaining you, let me give you more data. So you will have this kind of data analysis, and then you can compare with the 3 months, 6 months, like this. And let us see an example by actual analyzing this data. Because here you need to use the means command, whether there's a significant difference or not. This is the second patient, maybe age may be difference. Now, as time goes on, age also differs. So if it is in completed years, it may change any time. If it is in terms of months, then you should write down age in months, like that.
Yes.
So this you should be keeping in mind. Age doesn't remain stationary.
Yes, yes.
So like this, you will have a data. Now, when you want to compare, here, because there are multiple time series, it will be difficult for you to use the t-test, neither p-test nor paired or unpaired. T-test will not be able, you will be able to use it. So what you should be doing, you should be using variance test. That is the F test. And we'll see how we can use the F test. Try to remember the stating data. There's our name of the state. I will close this file. We'll switch over to the AP info. We'll read that file. Here I will be selecting XLS file. We'll browse. The first row contains header information. Yes. And stating data sheet we are going to use for the purpose of analysis. So 12 records are selected. If there is any confusion, you can stop me in between also. Here for the command of here the test for t-test and f-test both, the command in AP info is a means command, means of the time. Actually, we have the value, means of values as per the time. 3 months, 6 months, pre, like that. And in future, when you want to do advanced statistical test, at that time you can go for the stratification by gender, male and female. That difference you want to omit, then you can uh, add the stratification. Right now I'm not using because we have very small data. And it's not that our session for the purpose of finishing, it will finish on 31st July, but you may continue to work till we continue our sessions on different sessions. You can come out with your database anytime in future. You can send me it and we'll try to analyze. And that will be the real way of learning. So this is, you can see the comparison between the various means, etc. The pre is a 25, 6 months is 35, and 3 months 30. Now this, whether it's statistically significant or not, that you will get from over here. P is the f-test, if you look at, is highly significant. P value is 0.00, is highly significant. But at the same time, if you look at the population variance, right? So the test of inequality of the population variances, it's basically ANOVA is not appropriate over here, right? A small p less than 0.0 suggests that variances are not homogeneous and the ANOVA may not be appropriate because your sample size is too less, and that's why F-test is not possible. So in this case, if you really come across this kind of test, then instead of ANOVA, because sample size is very low, you go for Kruskal-Wallis test. And it says that yes, the difference is significant. So this is how you can use your AP info test. So I think it's very good efforts by you people, and I will stop sharing for time being. So your query will be solved next time when you go more in detail. But any quick question at this time?
Sir, I wanted to see how the factors are associated with my cognitive impairment problem. So should I go for regression test or correlation regression, or should I individually calculate the chi-square?
See, when you want to predict the variable based on other variable, if both are a
Correlation.
measurement variable or continuous variable, at that time regression equation you need to find out, and so you need to find out regression analysis, right?
So this will
And
be
correlation
multivariate.
coefficient in the two variable, two continuous variable, when you want to compare, right? You want to find out one based on other, that's the regression. And when you want to find out whether two are correlated or not, at that time you want to use the word correlation coefficient. So this analysis of two variables together, then the answer in case of the analysis part would be the regression, linear regression analysis, where you need to have two variables. One is outcome variable, suppose is the value, and other variable, input variable, is the age. Then is a very small sample to do this test, but in this case, you can do this kind of regression analysis. And in regression analysis, based on the regression equation, here they say correlation coefficient is 0.00. Absolutely, there is no correlation between age and value in such a small data. But if you larger data, you will find somewhere over here, if it is between 0 to 1. So if the correlation is 1, it is absolutely correlated with each other. If it is near to 0, it is not correlated to each other. So this is how you can find out. So in your study, you will be able to, by selecting over here, this linear regression, the output variable will be here and input variable here, like this. In other study, someone was talking, if you want to find out effect on blood pressure, then blood pressure will be here and the BMI will be here, like this. So this is the charm in using the AP info. Any other question you have? Still any question?
Sir, sir, just help me out to how to find a sample size. So should
Now
I
for
be
the
consider
sample size, for sample
prevalence of
size,
statins?
yeah, for
Patients will be
stating, for you need, for sample size, you need to first decide how accurate you want to have your data. So based on, see, when you want to find out standard error of difference between two mean, because there are means you are going to compare, right? In this
okay.
case, you need to find out how accurate you want to have. What will be the standard error? You can do the pilot study or you can study the research study, previous research study. You need to find out the standard error. Once you have standard error, then the formula for standard is equal to under root SD1 square upon N1 plus SD2 square upon N2. That is the formula for the standard error. Now you decide standard is basically tell you how much differences you would like to have. And in this case, stating you want to have 2 or 4, something like that. 4, you want to have a difference, then standard is equal to 4 is equal to SD1 square upon N1, N2. Suppose N1, N2, you want to keep it same. Then in that case, SD1 square plus SD2 square upon N. So you make a square of standard error will be equal to almost, you will say that SD1 square plus SD2 square. Both SD are same. Then you will have 2 SD square. So in this case, standard deviation, you need to find out from both the things. If both is not possible, you have taken, let's say, 10 or 50, you have 15 ka sample hai. In 15 sample, you need to find out standard deviation. Based on that standard deviation, you will be able to find out standard error with a particular sample size. Now, you don't have right now sample. You want to find out standard the n. So you assume that standard you should not have much more. So if you keep a less standard error, you will have more n. Because now what will happen? The n equals to, it will be as the square upon standard error. That will you will have. So if you keep a less standard error, more sample size. More standard, less sample size. This is how you will be able to calculate. Or you use the stat calc in case of the AP info, which gives you direct estimation of the sample size. But generally, in such study, you require minimum 40 to 50 samples. That will be sufficient. And if you have less patients, suppose 10 or 15 patients only, you should go for non-parametric test. And in general, for a standard proportion kind of samples, you require 400 samples. So any other question?
No, sir. Thank you.
So more the accuracy you require, more the sample size you require, right? And most of the time, if you have access to pilot study or the previous studies, that the data you can use in sampling sample size calculation. So any other question? So then I think I will just, if you don't have any question, I will go through this, what kind of thing you should have learned by now. Mm, Project proposal you should have submitted. Question answer you should keeping anything ready. And examples you should be able to make for all the 5 types of Z, how to, in any kind of study, you should be able to utilize that 5 kinds of Z, right? And then I think you should also be trying to use this thing, the case control study, cohort study, and randomized control trial. So let me say that this thing you should be able to do in your things also. Say cross-sectional is very easy for you people. that आपने population कहीं भी ले लिया, you have taken 400 population, screen them, both outcome input variable you are considering at the same time. Then in same study, try to think that you select the case first, then to that similar, you try to find out the controls, one or two more controls, and then ask the history in detail, whether they were exposed or not exposed. That's a case control study. Then in the cohort study, you try to have a two groups. One is exposed to certain thing or not exposed, or you can have you are in one group, you are giving advice. Is randomization is not done. Other group are not giving advice. The groups are not randomized. Only one group you are taking advice, other group you are not giving advice. And then you just move forward to find out the result, affected, not affected, or achieved, not achieved, like this. This is the cause study. But in randomized control study, in any case, what you are supposed to do, you select your population where you want to do the study. You select the sampling technique, prepare sampling frame, and with the sampling technique, you select your sample. Suppose you want to have a sample of 800, 400 plus 400, 800, then you select roughly 1000 and then ask them voluntarily, would you like to participate or not? So 800 agreed and matched to your criteria. Then this 800 are divided into two groups randomly. Divided into two groups randomly. With random number table or system random number technique randomly. And this 400 and 400 are then followed like this. One group, let's say it is A and B, then A group could be A group. Now it depends on the whether it's a single blind, double blind, or triple blind. So in A group, you are doing intervention. B group, you are keeping as control group, and then following both the group. That will be randomized control trial, in which if your intervention is of some kind of tablet, then one group you give a placebo, other group you give the study, the real tablet. Now, if patient is not knowing, the patient is not knowing is a single blind, doctors also not doing double blind, then the person who is doing analysis, that person also doesn't know is a triple blind. This kind of randomized control study would be better for postulating any hypothesis, right? The not postulating, but the confirming the hypothesis. So case control study will indicate this could be the hypothesis. The core study will say, yes, almost you are likely to be right. And randomized control trial will prove evidence that, yes, you are right. This is how we should go for the generation of the evidence. So before I close the session, I think this kind of the discussion on your project will be much better. Anyone is left out? Naveen have done, yes. Okay. Thank you. Any quick question? So, shall I close the session? Tomorrow also we are going to meet for any quick reference. If there is no question, we'll be just doing the practice session on the AP info so that you become well versed with AP info. So if there is no question, right?